Good day, everybody. My name is Mirvat Alasnag, and I'm welcoming you to day 2 of the National Heart Forum in Riyadh, Saudi Arabia. With me today is a very dear colleague, Dr. Jamilah AlRahaimi, the director of the Cardiac Center at National Guard Hospital in Jeddah. Thank you, Dr. Jamilah, for being with us today.
Thank you, Dr. Mirvat, and I'm really pleased and happy to be with you in this great forum.
You know, I know you do interventional echocardiography, and I just want you to emphasize and underscore the role of interventional imaging and advanced imaging in modern day practice.
Right. So I think we are all in agreement that the advancement in the cardiovascular sciences, the therapeutic option that has been now available for our patient, mandate the uprising in the cardiac imaging as a very important tool to assess patients in patient selection, as well as to ensure that we have a good outcome. Now, when we look at our advanced cardiac imaging available, we do start with an echocardiography and we proceed to CT and MRI, and sometimes the nuclear scan add to that information. The forum today summarized a very well advancement in the therapeutic procedure that has been available now for our patients. And the advancement in that interventional arm, I think, mandate to have the advanced imaging aligned very well in a very high scale with an expertise that can provide the information we need for our patient. This is starting from patient selection, patient assessment, and reaching to the appropriate outcome that we are looking on. Cardiac imaging, I think, is guiding all interventionists, intervention cardiologists, in selecting their patient as well as in planning their procedures. And we can see that the decision of having procedures done appropriately include the cardiac imager part of the team. These are very important points that we have to take in consideration when we talk on the development in cardiac sciences.
Absolutely. I can't emphasize enough what you just said, that it starts before the procedure, during the procedure, and after the procedure, the guidance, and it becomes really a collective part team decision.
Right.
So here in the kingdom, where do we stand in terms of interventional imaging, and what are the steps that we'll need to take to make sure we have the human capacity, the resources?
Right. So I think this is a very important question. When we look at advanced cardiac imaging, we're basically talking about the different modalities. We're including cardiac CT, cardiac MRI as a modality, and echocardiography, which is basically the basic imaging that started with cardiac sciences. Now, cardiac CT and MRI, I believe there is a very important tool added to that with the system that they're using. And now having updated systems and protocol is helping the cardiac imager in CT and MRI to really align with the advancement in the procedure skills and so on. Now, talking about the echocardiography, it's a totally different direction. When we look at the training of echocardiography, post-cardiac training, it's mainly focusing on the assessment part, which is the transthoracic transesophageal echocardiography training for assess patient and the disease and the pathology from the structural and the functional point of view. Intervention echocardiography, however, is really mandated, but kind of something come up recently in the last era, and that's mainly because of the advancement happening in the interventional procedure. So our kingdom, we are lucky to have a great group of interventionists, and actually they are pushing the imager to catch the race. But I think we have to focus very well on having an expert intervention echocardiographer, an echocardiographer who are skilled to be trained on an interventional procedure in order to guide the interventionist during the procedure and to ensure that we are selecting patients to achieve the outcome. These programs, if you talk about intervention echocardiography program, has been new actually in the era of training development. I can list very few centers internationally that start actually a fellowship program dedicated for intervention cardiology post-echocardiography. And the intervention echocardiography, post-echocardiography is basically moving from the advanced level of transthoracic transesophageal to an interventional level, focusing on structural heart procedure that require the presence of an intervention cardiology, echocardiography during the assessment and guiding the procedure and the interventionist. I hope to see that program developed in our kingdom, and I think we have really to read the need for that. We have a great group of an echocardiographer. Some of them are recently joined who already acquired that training during their fellowship because they came from the new recent generation. However, the rest, I think they should catch the team. It's very important looking at our centers and different centers in the kingdom, they all start to develop the procedure of structural heart procedures for their patients. I think having an intervention echocardiographer on all these centers will definitely ensure that they are doing what is needed for the patient. Our kingdom is very keen, and we can see the forum represented an excellent example how we achieved an excellent result in the cardiovascular sciences. And I think achieving that stage will even make us better to, at least be on the international level and the greatest outcome that we are looking for our beloved patient.
Absolutely. And I think, as you mentioned, it will take a little bit of time to get the training programs that are really a very subspecialty at this point in time. In the meantime, really collaborated with international training programs and having perhaps joint programs to ensure that the candidates get the volume that is necessary for them to achieve competence and comfort. Being independent echocardiographers and independent advanced imagers.
Absolutely.
Thank you very much, Dr. Jamilah. It's been really refreshing to speak to you today.
Thank you, Dr. Mirvat. The pleasure is mine.